Okay, so the question was, how do we treat chronic pain um, when we're really dealing with a system that has reorganized itself over time? Okay, so treating patients while seeing the entire picture, their life story through time and space, this is not abstract. From my view, it's foundational to Chinese medicine. And it becomes really essential when we're working with chronic conditions. As a reminder, we're always working within the interplay of heaven and earth, the descending forces from above and the ascending forces from below, which manifests in internal, external. We got to remember the body is not a fixed structure. It's a living process. And it's continuously shaped by environment, behavior, perceptions, experiences. Every patient that we find in front of us is the current expression of that process. So when we're treating acute conditions, these things are often more straightforward. There's an injury, an illness, a disruption, and we can focus on treating what's immediately present. But in chronic pain and chronic disease, the person, the system has had time to reorganize itself. And remember, patterns are not local. They're spread across, in biomedical terms, the nervous system, the fascia, the breath, the emotional body, and even the way the patient perceives and moves through and receives the world. So what we're treating is not just pain. We're treating a person, a system that has adapted to pain. And this is where seeing through time and space, and in this let's talk about time, becomes critical. We should ask ourselves, how did this begin? How has it evolved? What has the person's body done to compensate, to protect, to reorganize? And just as importantly, where is this system, this person trying to go now? And what directions of change are actually available? But at the same time, we should see this whole thing through space. The symptom, the pain, might be in one place, or two, or more, but the pattern never is. So we have all these different patterns, different contexts we can lay over the body. So a shoulder pain, a right shoulder pain, can involve the left hip if we're looking at the figure eight flows, but looking at other patterns, it could involve the pelvis, the jaw, the back of the neck. A digestive issue could involve the chest, the throat, the head, the lower back, and even the limbs and hands and feet. We should always be looking for and tracking these relationships, these patterns. Above, below, interior, exterior, left, right, front, back. Warming, cooling, faster, slower. This is the language of the pathways. This is the language of the acupuncture body for sure, and this is the language of the human condition. And when we move our focus to the level of the extraordinary vessels, this way of seeing becomes even more important. The extraordinary vessels function at a primordial level. Primordial meaning they emerged first in terms of time, and they operate at the deepest level in terms of space. They're not just pathways, they're part of the original blueprint of how a human being organizes themselves. They regulate patterns that unfold over a lifetime. Patterns shaped by both heaven, timing, cycles, destiny, and earth, structure, environment, embodiment. In chronic conditions, in chronic pain, this is where long-standing adaptations, constitutional tendencies, and patterns that have moved well beyond the primary channels are held. This is why they can be so clinically effective in the treatment of chronic conditions. They allow us to work with the deepest architecture of the system, not just the expression. And when we work at this level, something else shifts in how we practice. We ourselves begin to move away from certainty. Instead of needing to know exactly what this is and exactly how it will resolve, we allow space for what my friend Steve Cowan calls, I don't know yet. Not as a lack of skill, but as an openness to receiving and observing what the patient, what the system is showing us. Because in chronic conditions, the full pattern reveals itself over time. So we observe, we listen, we touch, we inquire, we track, we respond. We work with what is present while staying open to what is emerging. And this is where hope enters the treatment. Not as something we give the patient only with words, but something they begin to experience and feel in their own body. As we identify these pathways for them to take through time and space, we help create small but very real shifts, and the system begins to reorganize. All the pain may not disappear immediately, but something changes. There's more space, more movement, more possibility. And with that, a sense of agency begins to return. The patient is no longer just experiencing pain. They are participating in change. They begin to feel, they begin to know. My system can shift. I'm not stuck. There are pathways available. There is hope. And clinically, this changes how we work. We stop chasing symptoms and we start engaging patterns. We look for the relationships, not just the locations. We track change over time, not just day to day, not just session to session, but across weeks and months and years. And when I recognize that progress sometimes is very obvious, but is often subtle, non-linear, and multidimensional. We might hear a patient report less intensity, shorter durations, faster recovery, better sleep, more emotional stability, real shifts in how they are relating to the pain they experience. And these are not secondary outcomes. These are the signs that the system is reorganizing. And this is where our role needs to become more precise. More intense treatment is not better. More needles is not better. Stronger stimulation is not better. What matters is how close we can become to the intervention at the level the person needs at that moment in time. We'll call it accuracy. An accurate diagnosis, an accurate extraordinary vessel engagement, accurate timing. When we can see clearly in the context and across time and space, when we're willing to engage at this deeper, more primordial level, our treatment becomes less about doing more and more about being efficient and specific, and often more profound. Very importantly, working on the level of of the extraordinary vessels restores a sense of possibility. For the patient, it restores a sense of possibility. And for us as practitioners, seeing in the context of time and space restores a sense of possibility. And to me, this would be the medicine that we're practicing. I don't know. That was a bit of a rant. I don't know if it answered your question, but there it is anyway.